getting late period, can it cause infertility? So now let us first see why you can get late periods. So duration of a normal menstrual cycle is considered between 28 to 35 days. Anything which is beyond 35 days is considered late cycles or late periods. So why some women can get late periods? So there can be multiple reasons. So let us start with the commonest reason which we see in our OPD, which is anovulatory cycles, which means that ovulation is not happening in time, hence your periods get delayed. So commonest cause of anovulation in today's time is polycystic ovaries. Other than polycystic ovaries, other causes which lead to anovulation can be other hormonal imbalances, including thyroid and prolactin. So let us see what is PCOD. Polycystic ovary or PCOD is a condition where there can be delayed periods and ovulation, which means failure to ovulate, and also sometimes it can be associated with very heavy menstrual bleeding or very scanty or less flow in the periods. Other symptoms of PCOD can be higher side body weight, or it can also be associated with other conditions like thyroid and high blood sugars. Getting acne or extra facial hair or hair on the chest or abdomen which are coarse and thick are also symptoms of polycystic ovary, which are known as hyperandrogenic symptoms. So there are different types of symptoms which are associated with PCOD. So how do we diagnose PCOD? We diagnose PCOD on history, examination, ultrasound scan, and also blood test. So once all these tests are done, then the diagnosis for PCOD is confirmed. Now coming to the other reasons, which are thyroid and prolactin. Sometimes if your thyroid hormone TSH levels are very high, which we call it as hypothyroidism, then you may get delayed periods or late periods. Also, if your prolactin levels are very high, which can cause delayed periods and anovulation. So we need to evaluate for anovulation properly based on ultrasound scan and hormonal evaluation, history and examination. So it is not just one test which will tell me why somebody is not ovulating or getting late periods. So it's important that you get your complete evaluation done by a fertility specialist so that you understand the reason for your late periods. Now coming to the second common cause and also very alarming for fertility, which is related to the decreasing egg reserve. If somebody is having decreased egg reserve, the periods start to come irregularly. Sometimes even they get delayed by few days initially and also can be few months. So it is important not to assume the reason for late period as pregnancy or PCOD without evaluation. So how do we know somebody is having decreasing egg reserve? We start with the history. If you have family history of your mother having early menopause, your maternal aunt having early menopause, which is before the age of 40 years, then you are also at the risk of decreasing the egg reserve earlier. Somebody who has short cycles like 20 days cycles, 21 days cycles, these women also deplete their egg reserve faster. Also, women who have undergone any surgeries on their ovaries, like removing of the ovarian cyst, sometimes even removal of a tube for ectopic pregnancy, can reduce the blood flow to the ovary and decrease the egg reserve faster. If you have some autoimmune diseases like thyroid or diabetes, SLE and rheumatoid arthritis, all these autoimmune conditions can also decrease your egg reserve faster. So if you have any such history or if you are having delayed periods, it's important that you visit a fertility specialist and get yourself evaluated for your blood test, hormonal evaluation and also ultrasound scan to know the reason for late periods. So if you are having decreased egg reserve as the cause of your late periods, it's important you plan your pregnancy earliest so that you can conceive with your own eggs. If with the decreasing egg reserve you wait for natural conceptions for too long, you may deplete your egg reserve completely and can have premature ovarian insufficiency or early menopause. So once that stage is reached, it is not possible to reverse the condition or to make the new eggs come in the ovary. So it is important that if you are having late cycles, you should get yourself evaluated at the earliest and plan according to your fertility specialist advice. So these are the reasons for getting late periods. Sometimes if you have lost too much weight or you have gained too much weight, that can also cause delayed periods, but it can also be associated with other health conditions. So it is also important, even with the weight loss or weight gain, to get yourself evaluated from a fertility specialist. Other causes for late periods can be related to ovarian cysts, which are functional cysts, and most of the patients need not worry about their periods if that is the cause for delayed period. So this is about the delayed period. I hope this was helpful. So for fertility, it is important to have regular cycles. If your cycles are irregular, then you should get yourself evaluated. I hope this was helpful. Thank you.